Asian female, early 20s. Do I have eyelid ptosis? Too much eyelid skin, fat? Or is it just low eyebrows? The shapes of my eyes differ dramatically, depending on whether I have my eyebrows raised or not. I almost always have automatically raised eyebrows, and it's leading to a lot of forehead tension. Whenever I relax my eyebrows, my eyelids droop onto my lashes, my eyeliner disappears, resulting in angry eyes. I would just keep my eyebrows relaxed, but it's difficult to do so and keep my eyes open. Is it ptosis? What can be done? Botox, eyebrow lift, lasers, fillers, Asian blepharoplasty? Thanks.
Thank you for your question. You're in your 20s and you submitted two photos, one with your eyebrow raised and one with your eyelid low. And you're asking if you have eyebrow ptosis, do you have ptosis? And you also went down a good list of options for solutions, including Asian eyelid surgery, Botox, and a few others. So I think it's very important that based on the photos we get some terminology clear as to what you appear to have, and then I'll make some suggestions about what I would do for a patient like yourself in my practice. Just a little bit of background. I'm a board-certified cosmetic surgeon. I am a fellowship-trained oculoplastic and or oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. Asian eyelid surgery is in one of the areas of specialty in my practice, and I can certainly give you an opinion based on my experience. So let's begin with the question of, do you have ptosis? Well, ptosis means that the eyelid margin relative to the pupil is lower than it should be. So when you've raised your eyebrows and you look at the eyelid margin relative to the pupil, it looks normal. So I think it's safe to say, based on the photos you submitted, that you do not have ptosis or eyelid ptosis. So then we get to the next question about whether or not you have eyebrow ptosis. I don't think in your 20s you have eyebrow ptosis. Typically, eyebrow ptosis is an age-related change where the eyebrow slowly descends over time, and it's debatable the appropriateness of brow lifting or other procedures for the eyebrow ptosis. And for people who do have a little bit of eyebrow ptosis, Botox is an option. We call it the Botox Brow Lift. But in your case, nothing to elevate the eyebrows, I think, would be aesthetically appropriate for you. I would say that based on the way your eyes appear after you lift your eyebrows, I think you would probably be a candidate for Asian eyelid surgery. And I suspect, even though there's no physical examination, that your skin is the main issue in not defining the eyelid crease. So you would have an option, you would have some type of Asian blepharoplasty. Now what that means is you have a choice depending on physical examination and the presence of or absence of extra skin on having either a non-incisional or an incisional blepharoplasty. And to clarify that further, when in my practice, when there is no evidence of extra skin, and typically someone who's young who does not have extra fat, usually does not have extra skin, we do what's called a non-incisional blepharoplasty, where we make little openings from the outside and a stitch is placed in very strategic places that connects the skin to the levator muscle to allow for engagement to create that crease. Now, if there is extra skin, then a small amount of skin is removed, and the same concept of attaching the skin to the levator muscle to create an anchor, a crease, is performed. So I think it's best for you to now meet with qualified, experienced cosmetic surgeons who have a lot of experience with Asian eyelid surgery and decide whether or not this is an option that you're willing to undergo. It's important to understand that this is a very big decision, and if you like the look of having a crease and having more definition, which I think by the detail of your question and the extent of your question appears to be the case, I think it would be worthwhile for you to learn more after a physical examination. So I hope that was helpful. I wish you the best of luck. Thank you for your question.